Excellent. Good. Good evening, everyone, guys, and people joining from UK. Good afternoon, people joining from India. Very good evening, everyone. And on behalf of Team Prep Medico, I welcome you all for this FRCOphth slash FRCS Glasgow webinar, which we have been planning for quite some time to deliver. So I will not take much time. So I would like to introduce myself and a very brief overview about Prep Medico, and then I will introduce my wonderful faculty colleagues, and then we will go into the meeting. So I am Dr. Manikandan Kathirvel. I am one of a consultant hepatobiliary and liver transplant surgeon working in Royal Free Hospital and Whittington Hospital in London. And I am the director for Prep Medico, which is a leading edutech firm operating from UK as well as India. And we have been delivering courses for FRCS general surgery, vascular surgery, as well as ophthalmology, which we have started 6 to 7 months back. So our FRC ophthalmology program started, as I told, maybe 6 months back. And at the moment, we are delivering courses for FRCS Opht Part 2 orals, as well as the FRCS Glasgow Part 3 orals. And we have been having our mentorship group, Facebook group and Telegram group, and we have been getting plenty of inquiries regarding the FRCOphth exams. What's the difference between FRCOphth, FRCS Glasgow, what type of materials we need, how to start preparing, is there any course for FRCS Section 1, etc., etc. So we have built up our faculty body. So we started with 2 faculty. At the moment, we have 7 faculty working both from UK and India to cater the needs of you people. So the idea of today's webinar is based on the request by most of you colleagues. And we have an very enthusiastic faculty from our end who really wanted to, set standards on how to initiate the preparation, sort out all the queries for people who are aspiring to do FRCOphth or FRCS Glasgow. So in today's meeting, the idea is it's going to be a 45 minutes to a 50 minutes webinar, followed by a Q&A session where you can question us and we will be happy to solve all your queries. So I have 2 faculty today to introduce. First one is Dr. Rachna Kotayan. She is an ophthalmologist from Bangalore, at the moment in Glasgow, to be appointed as a doctor in the UK. And I have another senior consultant and visiting faculty for Prep Medico, Dr. Sonali Gupta. And again, she is working as a senior consultant in one of the big Delhi hospitals. Apologies, I don't remember the hospital, but she is also an examiner for both FRC as well as FRCS Glasgow. So today's meeting is to touch base and overview about the exams, the various pathway, what are all the resources, how do we move about, and of course, to sort out all your queries. So this is the whole idea of today's session. I'm going to welcome Rachna to come in and start her presentation, but I just saw she leaving us. Rachna, are you there? I think probably she's joining back. Sorry about that. Just give us a minute. Rachna, are you there? Rachna is back. Rachna, we're waiting for you. Can you hear us?
Sorry about
Hello?
the
We can't hear you, Rachna. We can't hear you.
Actually, some
Rachna, your internet is not good, I think. We can't hear you at all.
got
We can't hear you.
disconnected. I'm sorry about that. Hello.
Sorry, Rachna, your voice is breaking. We can't hear anything. Yes, now I can hear you.
Hello.
Can you hear us?
Hello.
Sorry, everyone, guys. We will sort it out in a minute. Probably a network. Unlike India, the network in UK is not good. Karthik, is it my issue or it's you can't hear her voice as well? Okay, fine. Okay. Can you unmute?
Hello. Am I
Yes,
audible?
Rachna.
I'm
You
so
are
sorry.
audible.
There has been a disturbance. I'm so sorry about that.
Is it your network is stable at the moment?
Yeah, I could connect back. I'm sorry about this. Just had a.
That's fine. That's fine.
Okay.
You can
Am I
start your
audible?
presentation. You can Yes, you are audible.
Okay. 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 So sorry about that. So let me begin. So good evening to everyone. Dr. Mani has kindly introduced me. And before you begin, like definitely all of you need to know something about who's addressing you. So I'm Dr. Rachna Kotian. So I'm basically from Bangalore. I have worked as a consultant ophthalmologist in Bangalore. So I recently cleared my final part 2 oral FRC of this October. So, and I've relocated to UK. I wish to pursue in the subspecialty of orbit oculoplasty and oncology. And now I've joined as a faculty at Prep Medico. So, rest of my journey and my experience, I will be sharing as and when the talk goes on. So, let's get to know the path and the exams first. Okay. So starting on, so let's begin with an overview of a standard route of the ophthalmology pathway in the UK. So basically, this is important because...
Excuse me, Rachna. Are you sharing your screen?
Yes.
We are not seeing your screen yet. You need to share your screen.
I have...
Yes, we can see your screen.
Okay. Yeah.
Yeah.
Is it seen now?
Yeah, and we can see the slides being changed also. That's fine.
Okay. Okay. Yeah. So let's begin with an overview of a standard ophthalmology pathway in the UK. So this is important because the outline remains the same as international medical graduates for us. So just that the entry points are different. So the ophthalmology pathway here begins with the MBBS of around 5 to 6 years, followed by what we call internship here is a foundation year 1 and foundation year 2 in the UK. Following the completion of these two, the graduates here get General Medical Council registered, and then they go ahead with the post-graduation, which is referred as a specialty training here. And unlike India, where the post-graduation is just 3 years, here it's up to 7 years. So it's specialty training year 1 to year 7. So once the specialty training in ophthalmology is called as the ophthalmic specialty training, and it's following the specialty for 7 years of training. In the end, they have a mandatory exit exam, like how we have our MS ophthalmology and DNB ophthalmology. So similarly, they have an exit exam. So this is called as the FRCOphth, or Fellowship of the Royal College of the Ophthalmology exam. So which they are expected to complete, which has 4 steps, and I'll be talking about that later. So they're expected to complete by the end of 7 years of training. So also they are supposed to gather all the evidences about their surgical logbook, the research, the conferences attended, and all of these things, and finally apply to the specialist register. So here there is a separate register to be working as a consultant. So when you get registered into the specialist register, only then can you be a consultant ophthalmologist. So now this whole pathway, which involves 7 years of training, ophthalmology training, along with FRCOphth, and the competencies, which means the surgical evidences, the research evidences, comprises of certificate of completion of training. So this is the word CCT pathway is what they call the most standard route of ophthalmology here. Okay, so now let's that also brings me to the fact that to get into the ophthalmic specialty training, it's not like in India, where just 3 hours of an exam with around 200 MCQs decides your fate. So instead, the trainees here have to work for the specialty that they want right from their foundation years. So they have to collect evidences, work in the department concerned, do publishes in the particular specialty, and work throughout, and they have to make their own profile and portfolio on a website. They have a separate application for it, keep uploading the evidences, and that will give them a score. Okay, that is what my next slide is about. So it gives them a score, which is called as a portfolio score. Apart from this, they have to give an exam as well, which is a promising fact about their ethics, about their communication to the patients as well. And then they end up with the interviews to the concerned department and the department and the colleges or the hospitals they want to get into. So like you see, it's a long drawn process. The worthy candidates only get into the specialty training. And unlike in India, where it's just a 3-hour exam with 200 MCQs that decides your fate for the rest of your life. So this is something that we all need to learn from the system in the UK. So I know, like, as an ophthalmologist, at some point we have all faced the comments like, oh, you're not even a real surgeon, or probably you didn't get any other branch, and so you have preferred this branch over the other branches. But let me brighten your Sunday. So ophthalmology is one of the most competitive branches. So 3rd, according to the survey by the Health Education England. So as I explained how one can get into the specialty training, so the applications that they receive is just for 100 posts. There are just 100 seats all over the UK, and they receive thousands of applications, and the ratio of the candidates is to the application is 23:1, which places us 3rd in the list of the most competitive branches, right after cardiothoracic surgery and neurosurgery. So yeah, so it's considered like the elite branch of UK, and only the brightest minds of UK graduates end up getting the ophthalmology seat. So I hope I have brought some smiles in the audience, and you can probably give this survey to anyone who makes such comments again. So yes, coming to the most important thing now. What are the routes as international medical graduates? What are the routes that we have? So typically 4, but the 5th one, I'll get to it. So the first one is the training route, so which is the usual route that I mentioned, what the graduates here take, and that gives the certificate of completion of training, that is a CCT. And the entry points as international medical graduates, it's only in the specialty training 1 and specialty training 3. The second route is the portfolio route, which is through the non-training pathway. And the third is the sponsorship pathway. The fourth is the medical training initiative route, MTI route. So, and the fifth one is pave your way. So that I will get back once I cover the four routes. So what is common in all these paths is the requirement of GMC registration. So GMC registration is a license to practice in the UK. So that's called as the General Medical Council registration. And this registration is possible via a couple of exams. So it can be possible via PLAB, which is a professional and linguistic accreditation board exam, which is a two-part exam held by the GMC, or it could be through postgraduate qualification exams. So this is FRCS or FRCOphth. It can also be sponsored by NHS Trust. The National Health Services Trust is nothing but the hospitals here are all under a publicly funded, a government-run chain of hospitals that is called as National Health Services. And these hospitals, individual hospitals, are called as trusts. So it can either be sponsored by these NHS hospitals or NHS Trust, which is called as a sponsored route, or it can be directly given from the Royal College of the Ophthalmologists. So which is like, how can I relate it? It's like AIOS, like All India Ophthalmological Society that we have in India. So similarly, this is a body of governing committee. So Royal College of the Ophthalmologists can sponsor it. So when they sponsor it, it is called as a medical training initiative route. So these are the four possible ways of getting the GMC registration. So in each pathway, the GMC registration process is different. I mean, the possible way to get the GMC is different. So let us see what it is. So coming to the first one, that is the training route. So as you can see that MBBS and the foundation year is not possible. So we have to enter getting the GMC registered, and we enter at a point of the specialty training. So get GMC registered, and this can be either via PLAB or it can be via the postgraduate qualification exams, like I mentioned, FRCS or FRCOphth. And then based on your competency and your experience, you can be either admitted into the specialty training year 1 or specialty training year 3. So you have to complete the entire 7 years. And along with this, you're expected to give FRCOphth simultaneously and complete it by the 7th year of training. Gather evidence of that means like surgical logbook, research and other conferences attended, and teaching experiences throughout your training for 7 years. I mean, the number of years of training that you have. And get into the specialist register and then be a consultant. So this is the same procedure that the UK trainees undergo here. And this route, the training route, is also called as the Certificate of Completion of Training. So on this reality check, it's highly competitive. There are very few limited international medical graduate seats, and it requires a very strong UK portfolio as well. This seems to be ideal. Like even I would have wanted to get into this pathway, but unfortunately, this ideal path has been only for the ophthalmologists who have come to the UK during the period of 2018 to 2023. So this is because since 2018, the ophthalmic specialty training, the whole concept of OSC training for 7 years came in only in 2018. And in 2023, they have made some amends which has restricted international medical graduate like us from entering into the training per se in these points that I mentioned. So why did I even mention this if this option has been shut for us? So this is very important because as this pathway is shut, there is no requirement of the exam PLAB anymore for the ophthalmologists like us. So PLAB is only to enter into the training route, and which is shut for us. So there is no meaning of giving PLAB exam anymore. So it was useful only when there was an entry at ST1 and ST3. And as of now, in August 2023, this pathway has been cut. And so there is no longer any role of PLAB to be given. So a lot of us are unaware of this because this change has been recent. And I still hear people giving PLAB. Even I wasn't aware of this until I actually looked into this. So the GMC registration is only dependent on the PG qualification for the graduates like us. So this is the NHS guidelines and the RCO eligibility criteria that was amended in August 2023. So to get into OST 1, the clause was introduced that the candidate must have less than 30 months of experience. So when the PG in India itself is 36 months, so we aren't eligible uh, to be in the training year 1. And as of OST 3, the last opportunity to get into this entry point was in August 2023. And they have proposed that the candidates like us, the international medical graduates, need to explore the portfolio pathway or the Caesar pathway. So this brings us to the most important route, that is the portfolio route or the Caesar route, that is the certificate of eligibility for specialist register. So this is the route to work on. So GMC registration is obviously required, but an important thing again to note that there is no room for PLAB now because the training room does not exist, and it's just via the PG qualification exam. So you register yourself into the GMC using either FRCS or FRCOphth, and then you get into the jobs. So either you have non-training jobs and you have fellowship jobs. So which exam can deliver which job, I will eventually explain when the exam part of the talk comes in. But until then, just take a note that you have to give these exams, get registered in the GMC, and then take up jobs. So while you're doing your job, you have to build your portfolio. That means that exactly why the name of the pathway is portfolio. So you have to have a surgical logbook, build in your publishers and build in your research, attend conferences and other CMEs. So all of these build over time and maintain evidences. So you have certain softwares where you have to upload these documents. And so it's exactly that what a trainee over 7 years will be doing. The exact thing, so you have to be equivalent to that 7-year trained ophthalmology trainee from the UK. You have to be equivalent to them to be on the specialist register and be a consultant ophthalmologist. So once you clear and get into a job here, you have to build that portfolio, those evidences which prove that you are equivalent to them. And this whole route is called as the portfolio route or certificate of eligibility for specialist register. So although the biggest catch here is, although the FRCS and FRCOphth give GMC registration and you can obviously apply for jobs and get the jobs, but eventually to progress in your career here or to be a consultant ophthalmologist, FRCOphth is a must eventually. So even though you might enter as FRCS Glasgow or Edinburgh and get into the job here, but you will be in your junior level, the registrar job or the trust level jobs throughout. You cannot move ahead above that level without having FRCOphth. So so this is a big change. This is what a lot of people aren't aware of, because FRCOphth has become the mandatory exam here, recognized everywhere. And so FRCS also limits to a certain amount of jobs, only a few jobs, whereas FRCOphth is opens doors to all kind of jobs and also to be a consultant in the consultant ophthalmologist as well. So yeah, as I said,
Rachna, can I interrupt you at this point?
Yes,
because
sure,
because you're telling lots of complicated stuff. Let us clear things with the candidates. So
okay.
To answer, so you were telling me that so you do 3 years of your post graduation in India, yeah?
Yes.
And you come here, even if you
Yes.
have FRCOphth in your hand, will you not be able to join ST3?
No, sir.
You can't join ST3.
No, that is the RCOphth the RCOphth guideline that has been put, that they will no longer be taken in ST3.
Can you show me that slide once again, just to
Yeah.
make clarity for all others? Means I'm pretty sure ST1 you cannot.
Yes.
The last opportunity was in August 23. Candidates with more than 30 months of ophthalmology will not be eligible. Okay, fine.
So this
So the
has
only
been
route
officially from the RCOphth website.
Yeah, that's fine. So the only option for people like you all to come and work here as a consultant is obviously FRCS Glasgow and FRCOphth will give you eligibility to get your GMC registration.
Yes.
However, for getting Caesar or CCT through the portfolio pathway
Yes.
is only with FRCOphth exam, but not with FRCS Glasgow exam.
That's right.
Yeah, you can continue.
Okay. So the portfolio route, what I mentioned, is just says that the post graduation in India is not recognized. So it just serves as an experience in that subspecialty. So you need to be so the acceptable post graduation qualification, what they term is just the degrees that are obtained by clearing these exams. That is FRCOphth, FRCS, Glasgow, or Edinburgh. So none of the Indian degrees are recognized, and that is why it is a must to either have any of these to be able to practice in the UK. So portfolio route takes up around 3 to 6 years. It depends on how robust you are in your surgically and in publications and your presentations and conferences. So, but yeah, like I mentioned earlier, the portfolio route, the end point is always FRCOphth, without which the becoming a consultant is not possible. And to apply for a specialist register as well, the eligibility criteria includes FRCOphth. So now a lot of the audience might have like the consultants who are already have lots of experience in this field of ophthalmology. So can they appear in FRC, or can they appear the FRC off and apply for the specialist register? So the answer is no. The fact that you clear the FRC off, but the evidences that you collect, the most recent, at least for 2 years, needs to be from the UK NHS. When you're being employed in the UK and being employed in the UK, and the surgical and the other logbooks all have to be, at least for 2 years, have to be from the UK. Only then you can be eligible for the specialist register. Your Indian data can supplement it, but it cannot be the sole evidence for your surgical expertise. So that is about the portfolio route. So does anybody have any doubts? I know it's a lot of information, but if you want to clear anything.
Sorry, doctor, for interruption, but this means that the blab route is blocked.
It's not blocked, but there is no point in giving the exam PLAB if you are already an ophthalmologist, because PLAB is just to get the GMC registration. To have any job here or to get into any post here, you need to have either FRCS or FRCOphth.
So when searching for jobs, and if I find the primary requirement is GMC registration, you mean the competition after that for the job is my knowledge or my certificates, right?
So the GMC, as I said, like the GMC registration is obtained via FRCS and FRCOphth also. Along with that, you will be ticking off another essential criteria of having this post-graduation qualification. So the jobs will, if you're aiming for ophthalmology specialty jobs, you can get PLAB and work as an SHO or a general, but you will not find ophthalmology jobs just with PLAB. You will just get a GMC registration with this exam.
So, Iman, I can tell you a little more information because I'm here for, I've gone through all these things. So, as Rachna told, PLAB exam is just an entry-level exam. Anyone can write. Okay, once you clear the PLAB, you get your GMC. That's all. You get a GMC number, which gives an license to practice in the UK. Beyond this, you have to apply for individual jobs based on whatever is your experience and whatever is your clinical knowledge and stuff. So as Rachna told, obviously, if you had already done an FRCOphth exam or something, you don't need to do GMC, because the getting a GMC registration, as Rachna told, one is a big PLAB route, which is common for any specialist who can take, or there are multiple subspecialty routes For example, a general surgeon can do an MRCS, an FRCS exam. A psychiatrist can do an MRC Psych. Pediatricians can do MRC PCH. Like you guys can do FRCOphth or FRCS Glasgow. So once you get your GMC registration, then you go into various job sites, you put your application, you fill your application, and then they will see whether you're suitable for the job based on the essential and the desirable criteria, and then you will be shortlisted. So that is how the job works. So to answer your first question, is PLAB not needed or not? PLAB is not needed if you have FRCOphth in your hand. But if you don't have FRCOphth in the hand, and say, for example, if you didn't have up to 3 years of structured ophthalmic training, you can still do a PLAB, get into GMC, and try to enter into the training number if that is something which you would look into. Did we answer your question, Iman?
Yes, doctor, because now the FRC Glasgow is having that shortage in the seats and very difficult to pass, and the FR London is more difficult also. That's why we're considering other routes other than them.
Yeah, as I told, you can consider that as a route. So if your aim is to, say, for example, I'll tell you a simple scenario. So you have been working in your country as ophthalmologist for 5 or 6 years. Okay, so that is your, as I told, the GMC or any of the trust here does not look into what degree you have, what except for the Royal College degrees. Okay, if you say that, okay, 5 years I have been working in an university hospital and my role is I am a retina surgeon or a glaucoma surgeon or whatever. Okay, now you are looking into getting into a job in ophthalmology in the UK, but you find it difficult to find a spot for FRCS Glasgow, or FRCOphth is very difficult. So you can still give PLAB exam. The PLAB exam will give you an GMC registration. So now you have the license to practice. Now, when you choose your job, say if you think that you have a 6 years of experience or a consultant level experience in ophthalmology, you can still apply for jobs, something like a senior clinical fellow job or a junior clinical fellow job, something like that. Of course, it is based on whatever, whether you are satisfying the essential and the desirable criteria which they provide. Most of the, say, for example, if you're joining as a senior clinical fellow in ophthalmology, one of the most essential criteria would be they would be asking at least you had covered first and second part of the FRCOphth exam. At least you should have covered that for you to get into a senior registrar job. So you can still do a PLAB exam if you can't do FRCOphth or FRCS Glasgow, and then apply for the jobs and you can get the job. Yeah, good. I think that you can put your questions in the chat box, but I think I will allow Rachna to continue with your presentation and then we'll go into the questions. Yes, Rachna, you can continue.
Okay,
you can continue.
Moving on. Yeah. Moving on. So coming to the next route, that is the sponsorship route. So sponsorship is something that is your GMC registration will be directly sponsored by an NHS trust. That is, you will be provided the working visa and the license to practice, as well as the registration through the hospital itself directly. So this allows long-term UK work, and the trust grade post as well as a clinical fellow post is also available in these in this sponsorship route. In the sponsorship route. So the only thing is it's very unlikely in ophthalmology, and very few trusts do have these sponsorship. They do not really rely on an international medical graduates whose surgical skills and the knowledge they cannot vouch for. But this route did open up doors during the COVID time, where there was a lot of vacancy, and the NHS Trust was ready to sponsor, and it invited a lot of international medical graduates who have joined the trusts and continue to work even today. Then coming to the medical training initiative route. So there's a lot of confusion between the sponsorship route and the medical training initiative route. So the medical training initiative route is a collaboration between the Royal College of Ophthalmologists as well as the each NHS trust. So in partnership with them, so this route allows short-term training. Like usually it's for 6 months to 1.5, 2 years, and it's a fixed clinical fellowship or training post. So there is once the contract or the fixed term is done, you are expected to go back. So there's no long-term settlement using this. However, while during your term in this medical training initiative in the UK, you can build your network and may do some researches and build your logbook, and which can be of help in your future plans of finding a job here and getting GMC registered. It will supplement. However, it cannot replace the qualifications required for your GMC registration and getting a job, but it can supplement your future plans in the UK. So there are so the trust themselves cannot bring up with the MTI vacancies. It's in collaboration with the Royal College of Ophthalmologists. So the existing MTI fellows who are accepted are in these foundation trusts like Moorfields, Manchester, Birmingham, Leeds, Bristol and Weston. So each of these hospitals have their own criterias and their own requirements and programs pertaining to each subspecialty. So it would be best if you could go back, make a note of these hospitals and go back to their websites and have a look at these, what they can offer. So here the RCOpth, the Royal College of the Ophthalmologist, will verify your credentials and act as a sponsor for getting GMC registered as well as for your visa to be able to practice here. So coming to the last one, that is pave your route. So this is what I failed to comprehend in the beginning, and that's what is very confusing. So the amendments and the rules do definitely say that there is no longer the entry into ST3 and ST1, but there have always been exceptions. When I say this, so it has become extremely difficult to get in if you do not have the acceptable postgraduate qualification. But there are a lot of inspiring stories of ophthalmologists who have the dedication and the passion to convince once you come here, you can convince the consultants that you are an asset, and it will definitely open up doors for you. So, but this route is highly uncertain and it takes a lot of patience. So like, for example, like there are a couple of people whom I know who are post MS ophthalmology, and they have got GMC registered and have just worked with a clinical attachment or as an observer for a couple of months in the particular hospital under a consultant. So when you put in the work and you put in, they know the potential, they can bend the rules and open up posts also, irrespective of your qualifications, and be more than happy to sponsor. So there is no hard and fast rule, but as I said, there is only a small amount of possibilities that are open if you're sitting in India and trying to get into UK. But if you really want to get into the posts here, there is a lot that you can do if you come and show up your abilities, and the rules will be bent if you prove that you're worth making the changes for. So eventually you will have to you will have to check the checklist that's required eventually. But because entering into getting the jobs here is difficult, definitely. So there is these are the some possibilities that you can also look out for. So it's not impossible. So it just takes a lot of patience and a lot of effort from your side. Yeah, because it's an uncertain pathway. Yeah. So that brings us to the next half of our talk, that is which exam. So we have FRCOphth London, we have FRCS Glasgow, FRCS Edinburgh, and FICO. So which exam is which exam? So a lot of us do not have the clarity between the differences, and also what exactly these exams can help you with in your future plans. So let us get to it. So the first and the most important and the upcoming exam is the FRCOphth London. So this exam is conducted by the body Royal College of the Ophthalmologists. So they're based in London, and this is a very prestigious degree to hold. So it is recognized globally, and this is a mandatory exam for every UK ophthalmology trainee. And like I mentioned before, so if you want to transition into if you want to progress in your career and not just end up and not just be in a job at the trust level job, to be a consultant you need to have FRCOphth. So FRCOphth consists of 4 exams. So you have part 1, you have part 1 written, part 2 written, refraction certificate, and part 2 oral. Part 1 and part 2 written are theory exams, which is MCQ based, and refraction certificate and part 2 oral are the practical exams. So the details of each exams will be covered in the separate session, because it itself is an hour long of a talk. So we are just going to give you an overview so that you know which exam to opt for based on your long-term plans. So the pros and cons. So pros is to be, like I said, any jobs and to be a consultant definitely opens up all the doors for you, FRCOphth, and it is recognized globally. And it opens up opportunities in the Middle East, in Singapore, Europe, and other countries too, because this is it's the highest academic standards that is set out in ophthalmology. So definitely recognized globally over any other exam. The cons would be it is extremely expensive. Sorry. Can I please
You
request
continue.
the
Yeah.
audience to mute yourself? Thank you. Yeah, the cons would be it's a really expensive exam, and it is time consuming, the 4 exams. And if you're giving it in India, so the practical exams happen like once a year. So you have like 2 years minimum going into these exams. And it's highly competitive. It's very difficult with extremely low pass rates, that is around 20%. So yeah, there are a lot of cons, but since it is highly recognized and an upcoming exam with being a requirement at every opportunity, it's something that everybody has to aim for over time at least. So this is a snapshot that I've taken from one of the advertisements of the job. So this is how they will make the essential criteria and the desirable criteria. So GMC registration, MBBS, complete training or equivalent, and desirable criteria, which is FRCOphth. So this is one of the jobs, and if you are seeing a fellow post, the essential criteria will have FRCOphth. So although you have GMC registration, so if you want to end up ophthalmology specific jobs, it's definitely prioritize having FRCOphth over FRCS. You are open to apply for any posts, and it is highly reputable and highly recognized. So if there are multiple candidates with FRCS and there are 2 candidates with FRCOphth, the trust will definitely go for the individuals with the FRCOphth without any doubt. And even more so, as international medical graduates with FRCOphth, they still are very skeptical about UK trainees with FRCOphth. So the competition is very high, and the jobs are the competition for the jobs are very high. So it is best to be at the top of your game so that you can choose the post that you want. So coming to the next one, that is FRCS Edinburgh and FRCS Glasgow. I think this is the most sought after in India. So what is the difference between Edinburgh and Glasgow? Is it the same? So even I had no idea until I actually looked into it and I started my journey in this path. So the first FRCS Edinburgh is conducted by the Royal College of Surgeons of Edinburgh. The body is Royal College of Surgeons of Edinburgh. And FRCS Glasgow is conducted by the Royal College of Physicians and Surgeons of Glasgow. So these two are Scotland-based degrees. The bodies are from Scotland, unlike FRCOphth, which is London-based. And the exam format is pretty much similar, with 3 exams, part 1, part 2 written, and part 3 OSCE, the first 2 being theory exams and part 3 being OSCE, or the clinical exam. So the attempts that are allowed are slightly more in Edinburgh and than Glasgow. And FRCS Edinburgh is internationally widely well known, more well known. This is because it has a lot more centers, a lot more attempts, and a lot more exam dates that are put out as well. Although the cost is slightly more than Glasgow, but Edinburgh is more widely known to the candidates just because of the large number of exam sittings that is available. But let me tell you that in terms of difficulty, and in terms of pass rate, and in terms of the academic credibility, both are hold the same, and both provide you with the GMC registration, and both will provide you with the non-training post. What I mean is um, just the training, the non-training, the trust jobs, or the fellowship jobs are unlikely with FRCS, because fellowship posts are taken up by the UK trainees after their 7 years of training, and with the FRCOphth, so we have to be at par with those trainees who are with the FRCOphth post. So fellowships usually require FRCOphth. However, just as a job, if you do not However, if you do not want to do a fellowship post, then non-training posts are available with FRCS Glasgow or Edinburgh. And it is definitely recognized globally. It is a prestigious exam, and there is no doubt about it. So a lot of Indian consultants and postgraduates do aim for this every year. And so that is about the FRCS Edinburgh and FRCS Glasgow. Like I mentioned, we will not be discussing the details about each of these exams, so which will be a separate session, we will be definitely holding this. This is just an overview so that you can know which exam to give based on your long-term goals. So coming to the next one, the last exam, that is the FICO, so Fellowship of the International Council of Ophthalmology. So FICO, it's just an academic validation of advanced ophthalmology of knowledge. So it would be surprising that FICO, the International Council of Ophthalmology, is actually Switzerland-based, who are in tie-up with the Royal College of Ophthalmology to conduct the exams. So it's not actually a UK-based exam. So it is just a tie-up, and conducting body is the Royal College of Ophthalmologists, but the regulating body is the headquarters are in Switzerland. So the structure is ICO, Visual Sciences, Optic and Refraction, and Clinical Ophthalmology. There are 3 exams. So it's globally respected, and it's definitely a CV booster. But please have in mind that you cannot get GMC registered, you cannot have visa, or you cannot apply for the jobs with this exam. And with this post, you are definitely eligible for the ICO fellowships that you have to look up in the International Council of Ophthalmology website. So they have a lot of, they are in tie-up with a lot of hospitals globally, in Singapore, Australia, UK as well, which allows the candidates to be in clinical training for a very short term in this desired subspecialty. So that's the only path that it can pave, the FICO, but it does not allow you to work or license you to work in the UK. So yeah, this is the comparison. So definitely prestige-wise and opening up opportunity-wise, FRCOphth London is a licensing exam. It's globally recognized and preferred, and it's the highest ophthalmological academic credibility, and it will definitely get you GMC registered as well. And then FRCS Glasgow and FRCS Edinburgh, these both are fellowship exams, definitely prestigious, definitely recognized globally, and will definitely fetch you GMC registration, but does not license you to be a consultant, like I mentioned. The last one is FICO. This just opens up ICO fellowships and is definitely a CV booster for in the graduates, for the graduates like us, and a lot of graduates do pursue this during their post-graduation, so it's definitely a CV booster. So yeah, so which pathway is right for you? So now I've listed and given an overview of all these exams. So if you want to do a fellowship or a job in the UK, you can opt for either FRCOphth or FRCS, but prefer FRCOphth over FRCS. The priority is changing. If you want to practice long-term in the UK, where you aim to be a consultant, definitely FRCOphth. If you're aiming to go to the Middle East, you go to Singapore, Australia, or anywhere in the Europe, FRCOphth more than FRCS, because although globally recognized, FRCOphth is the most prestigious exam in ophthalmology. If we want to practice in India, and we all have a habit of holding on to degrees, so just add on to your degrees and make it more bigger than your names. So it's such possible, then you can give all three of these. So, and also please note, giving lab giving plab is no longer advised, as the training pathway is closed. But like I said, pave your way is also a route. But although uncertain, if you're up, if passing these exams are difficult, you can also might as well get into the system via plab and go through it. But the solid pathway no longer exists. So it is better if you could clear the PG qualification exams, get GMC registered, and then apply for the ophthalmology jobs. Because jobs as itself is highly competitive. It will definitely it will be definitely easier for you to get into these jobs with FRCOphth or FRCS. Okay, so coming to this was about the exams as well as the route that is there. So something about my journey. Immediately, I did my MBBS from KMC Manipal and my MS Ophthalmology from Ramaya Medical College, Bangalore. I passed out in 2023. So following that, for 2 years, I have worked as a senior resident in Minto Regional Institute of Ophthalmology, Bangalore, and also at BGS Global Institute of Medical College. So for 2 years, I completed my senior residency at two of these institutes. I also worked for a part-time evening clinics in Apollo Hospital as well as Akshara Eye Hospital. I have also done 2 months of short-term FECO training from Siddharameshwara Eye Hospital, Gulbarga. So meanwhile, as I was working in all of these institutes, immediately after my MS, I started with my FRCOphth Part 1, gave my DNB ophthalmology as well, and then I started with my FRCOphth journey. So Part 1 in October 2023. So let me tell you that to the graduates out there, it is the best time to give this exam, because you're at the peak of your general ophthalmology knowledge in all the specialties. So it's the right time to give the exam. So I was at that state, I was all lost. I had just the information from RCOphth website, some vague YouTube videos, and Part 1 and refraction exams are the most difficult ones out of the 4 exams, with a pass rate of like around 20 to 30%. So it was a painful journey having no guidance. And I used to ask around WhatsApp groups, Telegram groups, and I used to find on Facebook the consultants who had FRCOphth as their degree, and personally DM them, asking them for some whatever helps, like some guidance regarding how they prepared. And I asked my friends who work in the NHS in other branches, and they gave me some lead, and I got some barely some info, and I built on that, and fortunately I cleared my Part 1 exam. And the same thing happened with the refraction as well. I absolutely had no guidance. I watched videos, I practiced in the OPD, and I was good at I am good at refraction and retinoscopy, because in Ramaya in teaching hospital, we were expected to do the streak retinoscopy and clear out the OPD, and which would be around 100 to 200 patients every day. But still, I did not manage to clear my refraction exam in first go. So in my second go, I somehow managed to clear it. So as it happens once a year, so that costed me one entire year and a big hole in my pockets financially. So the exam takes a lot emotionally, financially, and even in your timeline as well. So luckily, fortunately, in my Part 2 written exam as well as for my Part 2 oral exam, I found a handful of Indians, 3 of us, One is from Mumbai, Dr. Himali, and other one is from Chennai, Dr. Shasti. And there were a couple of Indians who had settled in UK and been practicing, Dr. Fahad and Dr. Fokia. So these, I found this group, which was literally a godsend group for me. And we practiced, we prepared together for this exam. And that is what could get me through a little more easily in the last two exams. But the journey is long and painful without guidance, and extremely expensive, and emotionally it was a whole tornado. So while your peers are finishing fellowships and doing great surgically, I was just burning out my bank account with like exams and exams. For like 2 years I have given 11 exams, so it was a lot. And I used to end up questioning my own question. I mean, was this really required? But like I said from the beginning, if you have a long-term goal in your mind, that will keep you going and not bother about what's happening in the present. So also, like, I have always been someone who has always aimed academically. I have always aimed high, genuinely enjoyed learning and reading, and have been fortunate enough to get distinctions, scholarship, state rank, and I actually even cleared my NEET PG in internship. So why am I actually sharing this? That's because, like, although like I have been academically sound all through my years, but my first real academic failure came in refraction exam. That was in FRCOphth, and that was quite a humbling experience. Like, from a single digit ranks to seeing that 4-letter word FAIL, it had shaken me in every way. So it was during that time that I realized that these exams are not about knowledge or intelligence. It is about understanding the exam format and the expectations, and to have the right kind of guidance, which I didn't have. So throughout my journey, I have just kept at it that just if only I had guidance, or someone who has given the exam to just guide me through, it would have made a lot of difference. So self preparation without mentorship makes the journey very long, very hard, and very expensive also. So with the right kind of guidance and structure and practice, FRCOphth or any exam for that matter is absolutely achievable. It's just like how in MBBS we used to run to our seniors to mark whatever is important, what question banks. Similarly, like that, if there are candidates with FRCS and FRCOphth to guide you, that nothing could beat that. So there is no, it's the same with FRCS and FRCOphth as well. So the struggles that we faced and the mistakes that we made shouldn't, you guys, the audience shouldn't have to go through the same struggles as well. And with the right direction, your pathway will be much smoother. Although the candidates do have to put in the hard work, but you don't have to walk the pathway alone. So this has been my thought all throughout my process, and I have rightly found the platform which shares the same vision as me, where I could deliver the same vision that I had. And Prep Medico is the platform that that is definitely helpful for the candidates in providing such guidance. And we do not, right now there is very minimal guidance for these kind of exams in the UK, and which are very UK friendly, and the international medical graduate friendly courses are very few. So definitely this platform Prep Medico provides guidance based on, like, we provide recent real exam experiences, those little tips and tricks which make a big difference in pushing you across the line. And these cannot be found in all of the other preparatory courses, and we do try to make a difference and to make it one of a kind. So definitely join us, join our family, and we would be more than happy to guide you in every way possible that could make us come through across the line and not make you face the same struggles and the mistakes that we made. So yeah, that would be my journey and my experience, and how I want to give back after this whole journey of my life that I had. So now, before we head on to the question and answer session, I would want to welcome Dr. Sonali Gupta, consultant neuro-ophthalmology, pediatrics and strabismus, who has cleared FICO, FRCS and FRCOphth as well. An extremely dynamic and a passionate ophthalmologist who will be answering all your queries. I welcome you to the webinar, Dr. Sonali.
Thank you, Dr. Rachna. for sharing your journey and giving such useful tips and guiding the candidates. So please feel free to ask me any questions. Just to add, I'm also an examiner currently for the FRCOphth and FRCS Glasgow exams. So if any of the audience has many doubts related to how to proceed in the exams, I'll be happy to guide you as well. And I am a part of the Prep Medico faculty. So in the course, we try to give both sides, the past candidates' experience, as well as what the examiners are actually looking from you once you come to the exam. So we would be really happy if we could guide you and help you and make your journey smoother.
So thank you, Dr. Sonali and Rachna. Rachna, your presentation was very wonderful, very clear and crisp. Thank you very much.
Thank you. Thank you, sir.
I will be the moderator for you probably. There are a few messages in the chat group which I can put up. Probably, Rachna, you can stop sharing your screen so that you are visible to everyone. So the first question is, someone has asked about short-term fellowships in the UK. Following completion of MS Ophthal in India, what are the short-term fellowships in the UK where the candidates can come, do that and go back? What is the advice on that, Rachna? I think, so yeah, Rachna, you can, yeah?
Yes, short-term fellowships, again, usually if you know your subspecialty and if you have a proper duration of time in mind, then you can approach your the medical training initiative. So you have a lot of universities coming to India to with their proposals for joining them as a fellow for 2 years, 1.5 years. So for example, like in Ramaya, we had a team from Leeds who actually addressed for medical training initiative. You can look up for the medical training initiatives from each of these hospitals that I listed. So they do have their programs every year and you have to apply, and they have their own interviews which you have to clear. And yeah, they do their interview, and based on that, if you clear their interview, you can definitely apply for the fellowships. Or if you're targeting only for 3 to 4 months, you can definitely go for write your FICO and apply for ICO clinical fellowships if you're looking for short-term fellowships only. And like if you want to return back to India, yeah.
I think as Dr. Sonali, you did few fellowships here. I think you would be able to give better idea about your experience.
Yeah. So as a part of my journey, as Dr. Rachna pointed, going in for a 3-month fellowship, or which is more of an observership, because one is not GMC registered just when you pass your post-graduation, but that gives you insight into the UK system. You know how the fellowship works, how the system works, whether it would fulfill your long-term goal, as well as it helps you build contacts. And once you sit for the interviews for the long-term fellowship, no matter how many degrees or even FRCOphth you have, but knowing somebody in the system and knowing how the NHS works always puts you at a pedestal over the other international graduates. So after the 3-month exposure, I finished my exams in the meantime and got GMC registration, applied through the NHS jobs website, and got long-term fellowships at Birmingham. So probably just after post-graduation, ICO as well as Ophthalmology Foundation is another one which has come up, similar organization. Both of them offer fellowships. It's good to go in for that first and then attempt for a long duration one.
Yeah. So again, yeah, as both of them told, from my experience, there is no separate fellowships. Okay. Most of the fellowships are basically jobs. When I say it's a senior clinical fellowship, which is also equivalent to a senior registrar job. So we call it a senior clinical fellowships if that particular job is in one of the regional referral units. For example, if you take Moorfields Eye Hospital, which has multiple subspecialties in ophthalmology, the jobs there, a senior registrar is called as a senior clinical fellow. So those jobs is like any other registrar job where you go and apply once you have the GMC. There are various websites where these jobs are advertised, like the track jobs, NHS jobs, even LinkedIn, they have jobs applied. You go and apply for the jobs. Once you're chosen in there, these jobs, they start with a fixed term contract of 1 year, but sometimes you can extend it for 2 years, 3 years, 5 years, depending upon your relationship with your team there. So that is what is a fellowship in the UK means. There is no named fellowship or branded fellowship like what we see in India. Yeah. I hope that answers your question. The next question by Dr. Apurva Sharma. As a third-year DNB ophthalmology resident, Caesar route is the best. What is the ideal way to go ahead if I want to settle in UK? I think that was already answered by Rachna. So the ideal route, if you want to settle down in UK, is for you to give FRCOphth exam. Obviously, more than FRCS Glasgow or anything. So by giving FRCOphth exam, that gives you a GMC registration also, and also gives you a clearance for you to build your portfolio pathway and enter into the specialist register. So the best route for you is do your FRCOphth exam, get your GMC registration, get into the job in the UK, build your portfolio, finish your Caesar pathway, and enter the specialist register. So that should be the pathway for you. So again, there's someone has asked, can we apply clinical fellow jobs after GMC registration through PLAB? I think,
No.
again, we answered this before.
Yeah.
But I think, so for example, Sonali, my question again to you, because our surgical departments works differently. So for example, say I had worked in India. I have finished my MS and MCH, but I don't have MRCS or anything. Yeah. I have 6 years of specialty training for whatever reason. If I get GMC registration through PLAB, I will still be eligible to apply for senior clinical fellow job in, say, colorectal surgery or upper GI surgery or HPB surgery. I really think that is the case in ophthalmology also. Is that right or it's different?
Yeah, it's partly right. It depends on the trust and the branch which you are applying for, how sought after it is. And there are junior clinical fellow posts as well, which usually get you over through MTI or even after PLAB. So like in Birmingham, in the QE, the Queen Elizabeth Hospital, my contemporary joined as a junior clinical fellow because she came through the PLAB route.
Yeah.
While I joined the Midland Eye Center as a senior clinical fellow because I came through the FRCOphth route. So if you're looking for a fellow post, it may be applicable for you after PLAB, but definitely the opportunities would be lesser and probably in the less desirable fields and less desirable places.
Absolutely. So for you, say, for example, if you want to do a separate, say, fellowship in, say, retina surgery or glaucoma or something, of course, you need an FRCOphth. But if you want to be a general obstetrician or ophthalmologist or a community ophthalmologist, probably PLAB would help you. But obviously, this is a junior level post and it does not add much value. Yeah. Good. Right. So let me move on to the next question. Could you please mention the names of those trusts where clinical attachments can be done? Who wants to answer?
I had actually put up the. I can reiterate. You can make a note of it.
Yeah.
Or probably I can reshare my screen. 1 second.
Yeah. So regarding this clinical attachment, so everyone needs to know that clinical attachment is something where it's an observer post, okay? So you come into any hospital to a department where you will not be interacting or touching a patient. You will just be walking around with a clinician, seeing what is happening. Ideally, clinical attachment can be obtained anywhere in any hospital, in any department. So the simple and the ideal route is no one will be advertising a clinical attachment job. Say, for example, I am a consultant working at the Royal Free, and if someone wants to do a clinical attachment, the simple thing is a contact, okay? So if someone knows me personally, he's going to write an email telling that this is me, I am interested in this field, and I would like to do an attachment. And it is absolutely the responsibility of the individual consultant who will be taking responsibility for you. So if I really want to help, say Rachna is approaching me, if I want to help Rachna, so I will send a clinical attachment forms, which she will fill, I will fill, then I will send it to my medical director. My medical director will approve that. So you will come in your own expense, you stay in your expense, you come to the hospital, watch what is happening and go. So this is how a clinical attachment works. However, of course, if you want to do a clinical attachment, you need to know what are the big hospitals which offers high-end ophthalmic services. And probably these are some good examples of, tertiary care or quaternary care centers for ophthalmology in the UK. Yeah. Rachna, did I answer your questions? If you have any questions, any, sub questions from whatever you had posted, you can raise your hands and you can ask us also, no problem. Yeah. So clinical attachment, this is how it works. So again, as Rachna vaguely mentioned, for your life, if you are planning to come into UK, the most important thing is network building. You need to have a very strong, network, knowing people, getting to know them, and them getting to know you directly or indirectly. Okay, you have to open your mouth, you have to speak to them, you need to email them, you need to disturb them. Only then they will. No one will come forward and voluntarily help anyone here. So network building is very, very important. And most of the jobs in the UK, although the frank truth is, yes, it all goes through a pathway. The problem is, say, for every job we advertise, say if one senior clinical fellow job is advertised in any branch, we get close to 500 applications. Okay.
Yeah.
So unlike any other, like an application in India or any other jobs where I can choose this, here, the applications has to be shortlisted through a process. Through a process in the sense, as a shortlister or as an recruitment lead, I need to spend at least 10 minutes per application to score them. And when I score them, I really don't know what is the name of the candidate or what is the age of the candidate. So it is all computerized. So I will put marks based on the scoring sheet which is given, and the computer will shortlist for me. So again, what happens in real life is we apply filters. When I say we apply filters, for example, if 500 application comes, if I want to shortlist 500 application, it takes 3 months for me. Okay, I cannot be wasting that much time. So what I tend to do is, okay, for one job, I will tell if anyone who does not have a UK experience, remove them from the list. So at least 350 applications will go away. Then I will have 150 application. In this 150 application, I will ask people without GMC can be removed. This will reduce another 30. So eventually, once I remove all these things, I'll have maybe 10 or 15, which are the applications which I will go through. Okay. So why I am telling you this is, so most of the jobs in the UK are usually through word of mouth, feedbacks, and their personal impression on you. That is where this clinical attachment again helps. Okay, so clinical attachment is probably sometimes the best entryway. Says you would hear people telling that I have applied for 500 jobs, not even one shortlisted. This is a very common thing people tell, but this is because you never made any effort to reach anyone personally. So if you do a clinical attachment, you go to the department, you show them who you are, how enthusiastic you are, and what all you can do. Next time when a job comes, the hospital itself will tell you, see, we are advertising this job, please apply for this job, and we will try our best. So most of the jobs in the UK, especially most of the competitive jobs, happens only through feedback. Of course, your application should be good. You should have ticked up all the essential and the desirable criteria, but it is through interpersonal relationship, feedback, someone recommending and stuff. So that is where, knowing each other and network building is very, very important. Yeah. Right. So next question from Nisha. On the website for FRCOphth exam, they require all the degree certificates to be attested. Attestation in the usual way by a local advocate would suffice, or is there a different form of attestation?
So this local advocate attesting would be good enough, or you can send the degree to your college, and the dean attestation from your college, that also will do. So either way, it is possible. Yeah.
Yeah, I think if you see most of the application, they have written very clearly who can attest actually. So all these applications, who can attest, they have given things very clearly, and it shouldn't be much of a problem. Good. So the next question by Suganya is the status of highest recognition for FRCOphth changes over the years. I really can't understand what's the question.
Yeah.
Okay. Suganya, if you are here, you can switch on your mic and ask us. Okay, I think she comes soon. Again, this is the problem with all the Indian candidates, they don't switch on the mic and show their face. Yeah, I hope you can come out and talk. Yeah. So the next one, Ashmita, FRCOphth exam to be given in sequence, as you mentioned, or it could be given in a different order, which is a very important question.
So FRCOphth Part 1 and refraction certificate can be given either way. But to give your Part 2 written, you have to have cleared your Part 1 as well as refraction. So only the first two can be given in any order, but part 2 written subsequently, and then part 2 oral after you clear the first 3.
Okay, so good. So obviously the last step is always orals.
Yeah.
The last but one is the part 2 written, and
Yes.
section 1 and the refraction can be given this or that in a way.
Yeah.
I would like
Good.
to
And
add
there is
that
Yes,
although
Sonali.
part 1 and refraction can be given at any time, but it is slightly advisable to start with refraction, because if you can aim to give that during your training, you have a good set of patients to actually do your clinical practice on. Part 1 is mainly theory, which you could do when you are in between jobs or deciding what to do next. So, like the trainees at the place where I am, those who have attempted in even their second year of post graduation have sailed through it in the first attempt, just because they had such a huge patient load. They saw the videos, they read it, and every day they could come and practice in exam style. While those, when you do the same thing after post graduation, even though you may know your retinoscopies, but there are few stations which need step by step just following the protocol. So even though it can be given interchangeably, may be advisable to start with refraction. And as Rachna mentioned, that is the toughest part. So once you go through it, you know you can carry on the pathway. In case anybody decides to abandon the exams, it is only loss of one part. Otherwise, you are stuck that I spent money on part 1 and now I can't pass through refraction. So maybe it depends on what suits your situation.
Absolutely, absolutely. So that's a very good question, and I hope you both have cleared it very clearly. The next is another important question. Say someone has given FRCS Glasgow Part 1 and Part 2, and now they realize that they want to do FRCOphth. Can they use the FRCS Glasgow parts with FRCOphth?
So part 1 FRCOphth can exempt them from part 1 of the FRCS Glasgow. While for part 2 FRCS Glasgow, the only exemption is the ICO clinical exam. So part 1 can be exempted, but the other way around doesn't work. FRCOphth does not give any exemption. So even if you have any exam, you have to start from the first part.
Okay, so that's a very, very important thing. So, for example, if you have done FRCOphth Part 1 or Part 2, and if you really think that, okay, I just finish off with FRCS Glasgow, then there is some leverage you have. But if you are changing to move the other way from FICO or FRCOphth, sorry, FRCS to FRCOphth, there is no shortcuts. You have to start from the beginning. Perfect. Good. Right. So would passing parts of FRCS Glasgow, okay, so that's the question answer. So would passing parts of FRCS Glasgow exempt us from any part of FRCOphth? No is the answer. Okay. And awaiting a structured guidance that we will answer. How much surgical knowledge helps in these exams? I don't know. What is the surgical knowledge needed?
In surgical
Sonali?
experience, if you feel in terms of doing the surgery, not really, but at least you should have observed the procedures or assisted in them, because in some cases you might be asked some steps like how would you do phacoemulsification in a hard cataract or one with an corneal opacity. So just reading those things from books can show that you have never observed or assisted. So having a good clinical and surgical exposure is good enough. Maybe only assisting, because I understand where the question is coming from. In India, the training is not very well structured. So many of the postgraduates, even after 3 years, are not confident to operate independently. But that should not hinder you from attempting these exams, because most of you have observed, assisted your seniors doing it, and that much should be enough to pass the exams.
Exactly. So as I told, this is a very difficult question to, and there's no standard of telling that, say, if you've studied for 3 years, you'll be able to pass the exam. It all depends upon the quality of training and what you have done and what you as a candidate is at your baseline. So it is quite very difficult. But say, for example, if someone is studying sincerely 3 years in their MS ophthalmology and then they have excelled as an above average candidate, is that knowledge enough for FRCOphth?
Definitely part 1 and refraction, and for certain amount part 2 written also, with your knowledge you can clear. It's a very in-depth, like if your basics are strong, you can definitely get through it. So the FRCOphth is a very conceptual based exams. So definitely being a good good student and knowing the base knowledge definitely helps. And if in your MS you have examined the patients well in each subspecialty, that will definitely help you in your oral as well. Although maybe working a little more in independent OPDs will definitely get you the management plan, which is a big chunk in the oral examination. But the basic structure of examining, which comes as a reflex, definitely has to be cultivated from the PG examination, PG years as well. So you can't enter into a subspecialty which you haven't seen at all and start examining during the exam. That is what, for the last exam especially, for the OSCE, it matters a lot. Yeah.
Yeah, and just to add that even if you are a very good MS candidate done from the best institute, these are very structured exam and sometimes require you to know the UK protocols as well. So you can't just walk in those exams even after being an excellent trainee here. You do need to do a structured preparation based on previous experiences and guidance. Otherwise, you won't excel probably in the first go.
Exactly. So as again from my good experience with the Royal College exams, the Royal College exams assesses whether you are a safe surgeon or not. We are not expecting you to be a very skillful or a knowledgeable person. What we need is whether you are a safe person or not, and whether you are following a standard protocol for all your patients. So that's what is all the UK exams are, and that is where the Indian training differs significantly from the Western training, and we need to unlearn a lot of things. In India, for example, what is expected from us is whether we are a brave surgeon or not and telling the right things, even if you don't know how to do. But here in the UK exam, the thing is you have to tell what you can do at that point in your career. Yeah, that is something which is tested in all the Royal College exams, irrespective of your specialty. So you need to know your limits on how much extent you can answer. If you go and tell that I'll do this and that, obviously that's a straight fail, and we will consider that as an unsafe behavior. Good. So the next question by Ramanan Govindraj, I think he has always been very active in the group also. Any timeline Prep Medico launching full-time course for FRCOphth? So as we told, we started with 2 faculty, but now we are very, very strong with 5, and we are planning to add 1 more. And we have few of them who are quite very keen in starting your part 1 as well as the refraction courses also. So we will be, in a week, we'll be launching our outline of what program and how we are going to launch it. In fact, we are planning to launch it in a very affordable way so that all the Indian trainees could benefit also. So we are coming up with a plan. Hopefully in a week, we will advertise what we are planning to do for part 1 as well as refraction courses. That we will do it. So Iman has requested Dr. Sonali, can you please explain in details what is the standard for passing the OSCE of Glasgow? Because some take 3 cases per station and fail, others 2 cases and pass. Some reach diagnosis and fail. Please explain what to do in each station.
Yeah. So FRCS Glasgow, or for that matter, even FRCOphth, sees your general approach to the patient, how you are picking up the signs, how your clinical techniques are, and how you put those signs together to reach a reasonable list of differentials and plan. So your last statement that some reach the diagnosis and fail, we are not exactly looking at the diagnosis. It may be a spot diagnosis, but how you approach, how you are thinking, are you ruling out the relevant differentials is what we are looking for. Then some see 3 or some see 2 patients. Glasgow, mandatory is to examine 2 patients. The third one is mainly to rescue you if some of the cases in the first 2 have not gone that well, and you do well in the third one, it can cover your marks for the station. But if you have done very well in the first 2 cases, you might not even need to see the third one.
Oh, well.
So if you have seen 3 cases, but out of them, the second and third or all 3 have not gone well, you can still fail. It's not about the number of cases, it's how well you have worked them up.
Good. So that's I think you have answered that question. Which one is more recognized in Gulf countries? Any idea by anyone?
This is FRCOphth again. I mean, it is transitioned already into FRCOphth over FRCS, and they know that the UK trainees have this as an exit exam now. So this is the standard now. Yeah.
Yeah. Okay.
And with new fields and all having their branch now in Dubai, they all expect the UK standards to be there.
Exactly.
In the UAE.
Yeah. Yeah. Good. I think Suganya has answered according to the webinar. FRCOphth has more weightage than FRCS. You are absolutely right. So if at all, if you're choosing one of the four, whichever is, if you ask which is the best to take, I think FRCOphth. Even if you don't want to come into the UK for whatever it is, of course, most of the ophthalmologists would know if you, or institutions would know that if you have done FRCOphth, it means you have cleared the highest level of competence. Say, for example, you are moving from one trust to a big corporate hospital, even in India. Say one person having FRCOphth versus one person having FACO or FRCS Glasgow, FRCOphth will be given more priority. And again, as Rachna told, FRCOphth is something which is recognized globally, where even you go to Australia, Middle East, or wherever this degree would be.
Sir, you're muted.
Sorry.
Yeah.
Did I answer or did I not answer? Did you hear my answers?
Yeah. Only the last
Okay,
part
fine.
of it.
That's fine. Sorry. So the next one is someone is asking you, is there any Telegram groups where you can find study materials for FRCOphth?
There are some Telegram groups, so I can forward them on the group after right away. Yeah.
Yeah. So few things which you need to know about the study materials, guys. Again, this is again from my vast experience in mentoring Royal College candidates in surgery. You know, there are several groups, several WhatsApp groups, several providers. Everyone have their own materials, etc., etc. Again, you should not be feeling overwhelmed by having, thousands of files in your drive and not knowing what you need to do. Okay. The first simple thing before gathering the material is you need to have your own framework. Again, preparing for exam is different for different candidates. Some would be very good sitting in a corner of a room, going through the pages and they can speak out easily. Some will be good with group studying. Some will be good in a different form of studying. So you need to know what is your strengths, what is your weakness, and then speak to a mentor who has already cleared the exam. And if you really rely on a particular, say, if you like Rachna very well and you know her very well, ask her what she did and you follow her footpaths, okay? Please don't go search here and there and join in multiple groups and just get overwhelmed, not knowing what to study, what to not. And again, different guidelines, different resources tell the same things in a different way or completely even in an opposite way. You really don't know what is right and what is wrong. So that is where, a reliable mentorship matters. And again, as I told, we have our, WhatsApp group. If you have any queries, to whatever extent we can, we will be able to. But unfortunately, because of various copyright stuffs and things, we will not be able to share any of the copyrighted content from our side. But I think if Rachna can help them personally, that's absolutely fine. Yeah. Right. So how much time consuming it is to clear FRCS Edinburgh or Glasgow compared to FRCOphth?
Yeah. So I'll take this question. I feel all three take similar time because you all know the parts of FRCOphth that there are 4 parts. For FRCS Edinburgh, they don't conduct the written exams themselves. They provide all exemptions to the ICO parts. So 3 ICU written exams, basic sciences, clinical sciences, and advanced. Those 3 need to be passed before you can sit the final part of FRCS Edinburgh, which is the OSCE. So again, it has 4 parts. And for Glasgow exam, it's again part 1 written, part 2 written, and part 3, which is the clinical one. So one part is less, but still based on the timelines where you are getting a sitting, because there are too many candidates applying for Glasgow and less seats available. So sometimes you are put on the waiting list for the center you are aiming for. So in the end, it would probably end up taking the same time as the FRCOphth. It's more about that if you're listening the webinar in the early stage of your training and you're clear you have to go for these exams, it's best to start as soon as possible, because once you start, a period of 2 years is a realistic time which most of us end up taking, maybe more.
Yeah. Okay. Thank you, Sonali. So the next question probably I can answer. I have applied in multiple NHS trusts for clinical attachments in ophthalmology, but didn't receive any positive response. Unfortunately, you will not receive if you straight away email to a department or to a trust. As I told, clinical attachment is the most painful offering any trust can give, because we are not going to get any benefit from a clinical attachee who's going to come in. Okay, for us, it's more responsibility because we need to have one more person in the ward, and we have to make sure that he does not do anything, which is the most painful thing. Okay, so if my UK patient is touched by someone or he goes and does something, then I am liable for that. So taking a clinical attachment person is very, very painful for us, and none of us actually like it unless we really want to help someone. So what you should do is, if at all, if you want a clinical attachment, you should not be emailing to the trust or the department. You need to find that particular person. Say, for example, if there is a consultant whom you personally know, or say if you don't know, say someone who is Indian consultant who is here, who is known to one of your consultant there. So there should be someone who should tell them that, okay, I have a candidate who is happy to come and work under you. So this clinical attachment should be initiated by an individual consultant working in the hospital rather than the trust itself. So try to find someone who is a consultant here, try to get in direct contact with them through email, WhatsApp, or even a phone call, and see if they are willing, and they should initiate, and you will not be able to achieve anything if you're trying to email the trust directly. Is that right, Rachna? Then maybe Sonali, yeah?
No, that's right, sir. Yeah.
Exactly. Right. Next question, would exam of FRCOphth Part 1 could be taken without GMC registration? Of course, you don't need a GMC registration at all for giving FRCOphth exam. You can write the whole FRCOphth exam sitting from India without a GMC registration. So GMC registration is something which is a license for you to practice in UK, with the license to practice in the UK. So it is not mandatory at all, GMC registration. If you want to just clear FRCOphth for whatever purpose to boost your CV, you don't need GMC for your entire exams. Right. Next question, sir. Does the status or the rules changes over the years, or it is permanent? Unfortunately, things are all changing, not very frequently, but we are expecting lots of changes to come up in the next 3 or 4 years in how an immigrant doctor would come into UK and work. There has been lots of protests in the UK already. At the moment, as we speak, the junior doctors are striking now. Okay, so that is why I'm sitting in the hospital, unfortunately. So the junior doctors are striking for two things. One is, of course, the pay, which they want to. And the second thing is the MBBS doctors, when they come out, they feel that the number of specialty training jobs, the numbers are very, very less. So that's why they are striking, which has been going on for 5 days. And as a part of the opportunities for them in specialty training, one of the agenda is immigrant doctors are coming and taking up their jobs. So as of now, there's no change, but I am expecting that in a year or two, you will be getting more preferences. The jobs will be offered to the UK trained people, UK citizens, than anyone else. Again, this was the rule until 2020. So I came into UK in 2019. So my first job was in Cambridge. So when I got my multi-organ transplant fellowship, so at that point, once we get the job, the trust will re-advertise the job, which is called as a market labor test. So until 2021, the job is preferred first to the UK citizen, then to a EU citizen, then to the outsiders. So if at all, if they give someone outside, say when I got the job, they will re-advertise the job for 1 more month and tell that we are offering for outside EU person. If anyone wants to apply, please apply. And if it's anyone is better than me, they will give a job. Okay, so this is called as a market labor test. But during COVID, they brought the entire medical jobs under shortage of occupation list. So when it came under shortage of occupation list, it became open to everyone. But now the government is trying to go back again, where they want to prioritize their trainees, UK trainees, the UK citizens, followed by EU, followed by outsiders. So things would change in the coming years. Yeah. Another question. Yes.
Can we, regarding very like specific questions regarding FRC of the materials and sources, we can cover it, like there will be a separate session for each of them. So we can cover it during that time pertaining to.
Absolutely. Absolutely. So we are coming with 2 or 3 more webinars specifically on preparation for each part, probably. FRC part 1, we can have a separate webinar and stuff. Yeah. put more efforts here, but then does the status of recognition changes? Like when we spend, I think the status of the recognition will not change. That kind. So when you get FRCOphth, the recognition for FRCOphth exam very, very unlikely to change. And the only exam for it to be the only exam for you to get CCT is not going to change, because this exam is this exam where the UK trainees also will write. So the recognition for the exam will not change, but what opportunities that would get you as an Indian surgeon might change. We don't know. Yeah. So I have cleared FICO advanced in 2022. Can I give FRCS part 3 in 2026?
I'll take this one. Yeah, well, there is no expiry or limit to the validity. Once you have done the exam, which provides you an exemption from the part 2, which advanced does. So now you can appear in part 3 anytime it suits you for the Glasgow one.
Okay, fine. So like the OST pathway has been removed now for international candidate. Okay, that's fine. So they have, okay, that's something. Okay, about MTI, is it true that they accept candidates only from best institutions from India?
It's not really related to the institutions. You have to apply for these. Definitely, like the institutes, prominent institutes do welcome the team to give a talk and all present the route, but they do choose candidates from all over the country. It all comes down to your credentials, your how, and you're actually going to be ranked in that amongst all the candidates that they receive, and based on the ranking, you will be sorted out into the subspecialties that the MTI route has to offer. So it's not pertaining to any institute. So you have to apply for it. Maybe if you are in an institute which is not very well recognized, you have to put an effort to search what MTI routes are available at that point of time. That's the only difference. Apart from that, it's equal for everyone.
So regarding MTI, again, from my experience, having been in the recruiting side, so there are two ways MTI works. So one MTI is something like a renowned institutes in the UK. For example, if I tell ophthalmology, say Moorfields Eye Hospital, which is one of the world-renowned eye hospital. So they have an MTI spot. There is some other trust which is in the corner of the country, which has ophthalmology, but unfortunately no one is going and joining there. Okay, that is other group of people who will also facilitate MTI. The MTI spots in big hospitals like Moorfield Eye Hospital, what they tend to do is they, apart from the service which they offer to the patients and in the specialty, they want to offer academic services globally. So what Moorfields Eye Hospital do is they have a kind of a tie-ups with leading institutes in India, where that is how the Leeds Hospital came to your hospital and they gave a talk. So Moorfields comes to, say, a big hospital in India, say for example, Shankar Nethralaya Eye Hospital, because it's a big hospital. So they come there, they will promote and they give preference to that. For example, King's Hospital in London is one of the big transplant unit in the Europe. Okay, so King's liver transplant unit every year comes to Madras Medical College to the surgical gastro department. Okay, and they conduct interviews there, and they offer one of the Madras Medical College candidate to come and do an MTI. Similarly, King's College goes to All India Institute every year and gives one candidate from there to come and work there. So that is as a part of King's College, dispersing the academic things as well as the surgical training in transplantation. So this is one route. Okay, so if you are in an exceptional institute, you will be in a good position where you will be approached straight away by a big trust like Moorfields Eye Hospital to give an thing. But on the other side, who else offers MTI is the hospitals which are in the countryside where no one wants to go. For there, because they don't get any one of them coming in, they have all the opportunities open. One is through the jobs, other through sponsorship, other through MTI. So because they want people to come and work. So these kind of institutions, obviously, it is based on individuals. So you apply through GMC and the GMC will offer these spots to them. So that does not matter based on what institute you work and who you are and what institution they are. But most of the MTI spots in bigger trusts like regional units, they generally have tie-ups with big institutes. Hope I answered that question. Yeah. Good. So I think the materials for refraction and part 1 we will cover separately. All books for FRCS Ophthalmology, I think we will be covering separately for the need of time. Someone has congratulated both of you for your time. What all documents to prepare to register for the exams? I think again, these things are very, very clearly given in the websites. Please go into the Royal College of Ophthalmology. Even if I tell you today, you will have 1,000 doubts. So best is go through the website, print that page, you see what all you have, what doubts you have. You can put up in the WhatsApp group, and we are very happy to clarify your doubts rather than listing what we know. Yeah. Iman, doctor, you mentioned it's not about how much we study, but it's about what the exam wants and how can we get it. Can you please mention what each exam wants to pass? Again, that is a huge question. Okay, if you allow me, I can talk for half an hour, half a day for this. So I think if you go through again, Royal College exams, all these parts assesses you step by step. Okay, in general, the initial steps are assessing your knowledge, and the later steps are assessing your skills to deliver your service safely. So that is by and large, but in detail, it's very, very difficult to answer, unfortunately. Yeah. Lots of questions. What's the best pathway for an MS ophthalmology candidate who wants to work and stay in UK for a short period of time and come back to India? Again, we discussed this. So if you want a short period of time, you just need to get GMC. So you can do any of those things, FRCOphth or FRCS Glasgow, that gives you a GMC registration. You come work and go back. But again, ideal and the best thing would be FRCOphth rather than FRCS Glasgow. When is the next FRCOphth exam? Again, you go into the ophthalmology website. Again, as I told, the exam has 4 steps, and 4 steps happens throughout the year. So you have to check the calendar in the Royal College website. Next is a technical question. Are FAICO and FICO both same or different?
No, I'll take this one. So FAICO is a subspecialty exam which the All India Ophthalmology Society offers. It only has one part, and theory and practical 2 parts, and it is completely different from the ICO, which is by the International Council of Ophthalmology. So that is covers whole of ophthalmology, while FAICO can be given subspecialty wise, like only cornea, only glaucoma. So you can go to the respective websites and see the details, but they are completely different.
Is this FAICO, is it an exam which runs as a part of conferences?
No, the body which holds the conference conducts these exams because there are many fellowships all over India in the subspecialty. So they have kind of advertised it as a common exit exam, that if you have this degree, you may be a fellow of anywhere. It needs a minimum experience of working for 2 years in that subspecialty at any place. And then you give this exam and you can say, I'm a fellow of glaucoma because I have this degree. But it's not an internationally recognized exam in terms that it does not give you GMC or any leverage for a job abroad.
Again, Rehana has a continued question about this attachment. So she had approached individual consultants who are willing to give attachment, but when it comes to the administration side, they would send me telling that there are no slots available. Yes, it does happen. It all depends upon how much the consultants push for. Okay, for example, under me, I have been having observers throughout the year for more than 2.5 years. There is always a push not to bring in any attachment because that adds so much problems to the trust. So it is, unless I push for it and I fight for it, it will not happen. So it means whoever consultants whom you had contacted, yes, they are willing to offer as long as the trust is happy, but you need to find a consultant who should go a step forward to really help you, or else it is not going to work, unfortunately. Yeah.
So I can give an example of myself in this actually. So I have been in touch with a lot of hospitals. I just approached, mailed the consultants who were there in the hospitals since last year during my process, because I knew I'm going to be relocating. So I have been mailing the consultants, and I have been troubling them for continuously for the last 1.5 years, and they always used to just say that, okay, we can see what we can do, but unless I have my FRCO or GMC or a visa, they can't really do anything like when I am overseas. So now that I have relocated here, I got back to the same consultant, one of the consultants that I approached 1.5 years ago, and I left a message that I have cleared my FRCO and I have relocated. And now finally, after like 1.5 years, I have gotten the opportunity to have a one-to-one meet with the consultant. So now I can approach and see what I can bring. So it's all about being consistent and putting your effort there to make proof that, you know, that you are worth their while, and presenting yourself. That's it.
Absolutely. That's the right word, actually. You need to, literally, I tell that, for example, if you take my WhatsApp or my LinkedIn or email, I get 15 emails, 20 emails a day. Generally, I don't reply first time. Okay, I wait for a month. I'll see only 2 out of 10 will be emailing me again. In that 2, when I reply, half of them won't even reply back. Of course, I will not be interested. So you need to prove your commitment and interest in your specialty. Literally, you need to torture your other person in a way that, oh, see, I'm interested to an extent that the person who is offering you the attachment should feel guilty of not helping you. So only when you go to that extent, anyone would help. So it needs a lot of push, perseverance, and commitment, or else it's not simple, So the best, that's where again, your link building and, networking plays a huge role. That is where again, the team like us also help you, because now if you see, say Rachna is in UK, we have other faculty in UK, we have Sonali who has worked here and she's in India. So now when you are attached, so you have like 7 or 8 people in different countries. So if you want, we might be able to help you. So this is a kind of a networking. Same like this, you should be in different groups, knowing different people. So that is how you can develop your network and get into more opportunities. Yeah, right. So that is fine. Is GMC required for MTI or sponsorship route? So yeah, Rachna, you can answer this.
So GMC is definitely required, but it will be provided by the FRCOphth or by the NHS trust that is going to be. They'll basically sponsor the GMC registration for you. So that would be it.
A few things again with MTI. Basically, you can apply for MTI only from India if you're from India. You should not be in the UK, first of all. Mm-hmm. In fact, if you had cleared the PLAB exam by any chance, you are not eligible for MTI again. Okay. And you should not be having a GMC to apply for. The idea of MTI, it's a medical training initiative, which is an initiative by all the Royal Colleges to help the developing countries' doctors to come train and go back. So basically, so if you're just an MS graduate, so we will give you a 2 years fixed GMC registration. You come here, and this is a student visa. You come under a student visa, not a tier 2, which is a skilled worker visa, which has lots of restrictions. So you come here for these 2 years, work for 2 years, and you go back. So the GMC is offered to you as a part of MTI, and you don't need to do anything for that. Of course, you need to do this English exams and stuff. Those things are different. Okay. Right. So again, this question has been answered. FICO doesn't exempt you from FRCOphth. Does FRCS Glasgow give me chance to work in UK, Saudi Arabia, and if yes, will it be a consultant post? So FRCS Glasgow, and we don't know about Saudi Arabia. I don't think anyone would be able to answer about Saudi. But in the UK, FRCS Glasgow will give you an opportunity for getting your GMC registration, which, so for working as a substantive consultant, which is a permanent consultant in the UK, you need to be in the specialist register. For you to be in the specialist register, you have to have FRCOphth. But FRCS Glasgow, you can get GMC, but if you want to be a temporary consultant, we call it as a locum consultant, which is possible, which is being offered in few places also, I would say. But if you want to settle down as a permanent consultant, FRCS Glasgow will not be able to offer you. Yeah. So how can I join on the Prep Medico WhatsApp group? I think you can, they have put the group here.
I have already forwarded the link with all the Telegram, Instagram, and all the links. in the
Excellent.
flyer.
Perfect. Is GMC required for applying clinical attachment posts? It's not needed. Okay. You don't need a GMC. As I told, clinical attachment is something you come here, you watch and go. You don't touch any patient. You don't do any clinical work. Okay. Oh, wow. So many questions. FRCS Glasgow, specialist in Saudi Arabia only. I don't know what is the answer. What is the question here? Specialist in SA means, is it Saudi Arabia or South Africa?
I think somebody is
Saudi Arabia.
answering the previous question, which they
Okay, fine. Could you please tell us about MTI versus dual sponsorship scheme? I really don't know what is dual sponsorship scheme.
This is the same, the sponsorship route itself. Sometimes it requires that a consultant from India also have like a letter of recommendation, what you say, along with the NHS trust, which is ready to have you sponsor the GMC. So that is when you call a dual it's equivalent to, it's similar to sponsorship route itself. It's called dual sponsorship because there is a sponsor who can vouch for you from India, and there is a sponsor who can vouch for you from UK. So that's it.
So regarding the sponsorship scheme, I want to tell you a few things. Okay, so the sponsorship basically offers you a permanent GMC registration without exams. Yeah, so you get a full GMC registration without exams. However, getting a sponsorship is not easy at all. No one is going to say, for example, Rachna is coming to me asking me to sponsor. I will not sponsor her because I am liable for anything Rachna does throughout her life. So how it works is two ways. One is, as I told, say my institution is in tie-up with All India Institute of Medical Sciences. And we have an understanding that the candidate coming out from All India Institute has certain things, so we can give them directly. So that in that way, a sponsorship works. The other way how the sponsorship works is, so that kind of things works only when you are in a big reputed institutions, or your boss is a very big boss who can tell here, and people tell that, oh, trainee of this particular man, Dr. X, is always good. That's fine. The second way of sponsorship is, say you came here and worked as an MTI for 2 years. Okay. And then in the end of 2 years, you're planning to go back, obviously, but you want to continue here, but you have not finished your exams. So in that situation, me as a consultant, I would have seen you working under me for 2 years, and I really know that he is very, very good. I can fully vouch for him, then I can sponsor. So these are the two ways sponsorship works, but I would not recommend sponsorship for anyone if you want to. So people think that sponsorship is a shortcut to come into the UK without the exam, but that's the most painful way. And the chances of getting a sponsorship approved, I would say, is less than 5%. Unless, as I told you, you're coming from a big unit under a big boss who is an authority in the world, something like that, I would say. Yeah. Do you agree with me, Rachna?
Yes, sir, definitely. Yes.
Yeah. Okay. I think we need to finish this meeting in another 2 minutes. Dr. Sonali has another session to. Sonali, if you want, why don't you can leave actually, because you might need to prepare for the next session, isn't it? You have a course, yeah?
Yeah.
Thank you, Sonali, for joining. Thank you so much.
Thank you so
Thank you,
much.
Dr. Sunil.
It's really nice. Thank you.
Thank you. Right. So could you please, that we have discussed while doing MTA in UK, we can appear for FRCOphth from UK so as to get permanent GMC in long run. That's absolutely right. You can do that when you're working in UK. Can you apply through MTA route if we have already got a dependent spouse visa? Which is a very technical question, actually. It's a tricky question.
I think because still the person won't be GMC registered, it's still valid. And if you have the passport, you're technically a resident of India still, I think you can apply.
I was told, I might be wrong, but I was told that if you have even a valid UK visa, or if you are living in the UK, you may not be eligible, is what I thought. But I think I don't want to give an answer without me knowing this. It's quite a complex question.
We can get back to you.
Yeah, we can get back to you on that. Yeah. Clinical attachment and observership are same. It's a very good question again. So clinical attachment actually is basically, for example, say, for example, someone from US is coming and working under us. So if someone is certified in US, when they come into the UK, you have, to some extent, they can even be involved in clinical jobs and stuff. So clinical attachment, by definition, allows that particular participant to be involved in the clinical work also, actually. Yeah, so you can be seeing the patient, you can get history from the patient, you can attach, you can, you can assist in the theater. However, for a proper clinical attachment job, you need to go through your what is it called? The blood tests. Occupational health blood tests you need to undergo police verification, etc. So all these things are checked, and you will come as a clinical attaché, where you will work like a junior doctor under supervision. But observership is just opposite, basically. Observership, again, attachment and observership are used interchangeably. So in a simple word, if you don't have a GMC registration, or if you don't have a license to touch a patient here, attachment and observership is the same, where you have to observe. But if you're coming from any other countries, the things are different, actually. Sometimes, candidates from, say, a general surgical trainee from one trust comes to a specialty department for us. For example, an ST3 surgical trainee comes under us to help us as an attachment for 1 month to know how a liver transplant unit works. So that is called as a clinical attachment, where he can scrub in with our case, he can participate to get to know and experience about how the specialty is. But observership is purely very, very superficial. You are not allowed to do anything. Yeah. So I am from Pakistan. I have done FCPS ophthalmology after a 4-year training. Okay, now I am preparing for FRCS Glasgow. Please tell me, after FRCS, what opportunities I have abroad, either in UK or anywhere else. So we discussed before, you have, as I told, opportunities are always there. Getting that opportunity, it all depends on your skills, how you approach, and how people are guiding you. So you will get your GMC registration after FRCS Glasgow, and you can come and work here. And the consultant, as we told, as a temporary consultant or a locum consultant, you can be offered in one of the corners, not in the main cities. But if you want to become a permanent consultant, you need to have FRCOphth and portfolio pathway and stuff. So what's the maximum time period we can do clinical attachment? As I told, you can do any number of months, as long as I offer you. So because it is a discretion of the consultant who is offering the attachment, I can tell you that, okay, as long as you can pay and survive by yourself, you can stay here how many ever days you want. I can tell that, or I can tell that you can stay here maybe for 4 weeks. So it all depends upon, but it is not going to add anything to your CV, or it's not going to take down anything, and it is not considered as a training program. It is not counted as anything for your training program. Okay, so you will just come and go. So there's no other. So after
And there's no
FRCS
salary as well.
exactly, you need to feed yourself. You need to live by yourself. You have to come and go yourself. But we would expect you to come. Yeah, if you come here, of course, we want you to come. Yeah. After FRCS Glasgow, GMC registration will be temporary or permanent. It is permanent as long as you pay the annual subscription. It's not like once you register, you have your GMC number. So you have to pay. So one, you have to pay subscription for your FRCS Glasgow. So once you clear the exam, every year you have to pay the Royal College to continue using your degree FRCS Glasgow. Similarly, once you become eligible for the GMC, in order to continue your license to practice, there is an every annual subscription fee. On an average, the subscription fee is close to £600 a year for GMC registration. And for FRCS exams, I really don't know how much is the subscription fee. How much we need to pay, Rachna, for FRCOphth?
FRCOphth is pretty expensive. So the 4 exams, I think the practicals are...
No, not about the exam. Once you clear the exam, how much annually you need to pay to hold the degree?
Oh, that's for the RCS, around 600 it will be, yeah. The
exactly. So
membership fee,
yeah. So you have to continue, for you to continue your degree and your GMC registration, you will be spending close to £1,000 a year until you want to have it. Yeah. Okay, again, someone has called about clinical attachment posts. I think we have discussed a lot. Probably you can, this video will be recorded and we will upload in the Prep Medico YouTube channel, and we will also share in the group and you can have a look. And do we get paid during the clinical attachment post? Not. You will not be paid a single penny. Yeah, you have to look after everything, stay, food, everything. Yeah, good. Any other questions from anyone else, guys? Who wants to raise a question and answer, or any questions about anything else? No? I hope this session was very useful to you all. And probably we had answered the basic question about what are the difference between these exams and what to choose for you. That's the whole aim of this webinar. Of course, we are coming up with few other topics like individually, which we will come up. So rough salary of a locum consultant after FRCS. So any consultant in the UK, the starting salary will be somewhere around £105,000, which is maybe in Indian rupee, it is 1 crore, 10 lakhs a year. But of course, remember 45% we will take out tax. Yeah, only 50%. No, 45% is tax. At least 40% is tax. And then your national insurance contribution will be around 12%. And then your pension will go another. So if I say 1 crore is your salary, you take home maybe 45 lakhs in a year. Yeah. Good. Excellent. So still, if I already hold FRCS or someone still has, Rachna have cleared FRCO, how was your experience in getting a job? What's your experience in getting your job in the UK, Rachna?
Okay, so I just cleared my FRCOphth in October. So I have applied for GMC registration, which is I'm yet to hear from them. So I'm in the very initial stage, and I'm applying for the applications as well. But yeah, like I said, like we discussed, GMC registration is the first thing they ask. So my application is out without any this. But like I said, I have noticed that a lot of these fellowships which I want to get into require the essential criteria itself says like FRCO, the essential criteria, not even like desirable criteria. So I noticed this even like during my post-graduation itself. I had made a note of this, and that is why I opted for the what can be described as the most difficult route, like FRCOphth. But then in the end, it is all worth it, because there is no other candidate which will be chosen above you just merely because you don't have the degree. And now it's just the CV, and Indian CVs are like the number of cases that we have seen and we have done, it's really strong. So having not getting a job because of a degree, it doesn't make any sense. So better give the high exam with the highest credibility to get the job that you want. So I am applying for the fellowships. I hopefully must be able to get the fellowships that I want now that I have FRCOphth, which is one of the essential criteria. And it's getting difficult, definitely, because of the shortage going on, and they are not preferring the international medical graduates over the trainees. So it's definitely difficult. But in this scenario, not having any shortcomings of like in degree would definitely like make wonders for you in getting your first job. Yeah, and which is why I have also entered into the clinical attachment or observership meanwhile, so that I have some base and foundation, which will definitely make me end up in like a fellowship eventually. Yeah.
So one more thing to add on here, maybe even for Rachna, maybe it might be useful. So if at all, if you're planning to come into UK, as I told, just your exams or degree alone doesn't matter. If you see any jobs, you have an essential criteria, and they say, again, essential criteria, whatever Rachna spoke is just the knowledge. Okay, in the knowledge, we want this. Okay, again, clinical experience, okay, we want someone to be able to do independently, but we also look into several other things, including your teaching. What is your role in your academics? What is your role in quality improvement projects? What is your role in audits? What is your role in publications? What is your managerial skills? So all these things are taken into consideration. So that's why if anyone is planning to come into UK, maybe in the next 1 or 2 years, your aim is not just getting FRCOphth, but also other areas where you should show your talent in as a manager, okay, running a department, or being a rota coordinator, or leading a group, or training someone, something like in a managerial role or a leadership role is very, very important. Similarly, you need to do some structured audits. Okay, audits in India, I really don't know what is your understanding, but we need to do a proper audit, a proper quality improvement project. Again, publications. Again, publication is very, very important. People think that presenting in an international conference or a national conference matters. It does not add much of a value. You have to do some publications whenever, wherever possible. So including all these skills are very, very important along with your ophthalmology to score more marks. Okay, so if you have all these things and if you're a pleasant candidate, when we recruit candidates, we don't want just a person who has a degree. We want a person who will be able to support the department in every possible way. She should be able to teach. She should be able to run the department. She should be able to do some publications for the unit, able to run this one, good communication skills, everything. So that is how a complete candidate makes. It's not like India where you are assessed based on a NEET exam or this exam or a single mark. Yeah. Oh, still the question goes on. Where are we now? Okay, and what's the maximum time period that is finished? Okay, a lot of things got cleared today. Okay, rough salary idea we discussed. That is fine. If already hold FRCS Glasgow and plan to stay in my own country, do you think FRCOphth confer any substantial benefit to me? As I told, it may not to be, but to some extent, yes. For example, having an FRCS Glasgow, FRCOphth is obviously superior than FRCS Glasgow. It will add to a CV if you are in a young professional in your career. It might help you to, exponentially grow in your career. Of course, your salary might also go up because more of your technical knowledge skills you have, of course, you might be given more benefit, obviously. So again, Mahashaya Shakir, we have answered that question. Do we pay? Again, those things we have. So that's a good question. Do you pay for clinical attachment post? Yes. Not every institute. There are few NHS trusts whom you need to pay. You need to pay for a clinical attachment. For example, I know few surgical units which offers clinical attachment. They charge close to £400 for 4 weeks of clinical attachment. So it's not standard. It's not mandatory, but different trusts have their own policy. So as Dr. Mani mentioned, recent protests in UK, immigrant entering the NHS system, is it advisable to clear PLAB ASAP and get GMC to get into NHS SFR? It doesn't matter actually. So this is not going to change in any way. You getting GMC, no one is going to stop. What is going to change is you getting a job in the UK might change. So getting a GMC through PLAB or getting a GMC through FRCOphth doesn't matter. So I would not support this one or that one. Suggested journal for public. Again, this is something which if you are a ophthalmology trainee or so, you should have an insight by now, whichever is the standard international journals, whichever is possible, you need to have some idea, but again, that is out of scope of this particular meeting. Yes, so we will be sharing the recorded video of this webinar in the WhatsApp group. It will be in the YouTube and you can go for it. And we will be putting up all our updates in the group. We are coming up with new programs with FRCOphth Part 1, refraction certificates, etc. Yeah. I think we should conclude this meeting, but I would like to wholeheartedly thank Dr. Rachna for your time. And in fact, it was in a very short period. I just spoke to Rachna maybe 3 or 4 days back, and she planned everything in the last couple of days, which is commendable. And her way of presentation is very good. It made clear several things, including me, who is not even an ophthalmologist. I got cleared from what is this path. So I congratulate you on this, and I'm looking forward for a long-term association. And I wish all the very best for all the candidates who have participated today and who are aspiring to become, get these exams in the future. Any last words from Rachna? Anything?
I was really happy to see the turnout today was great, and the participation has been great. So hopefully the talk has been helpful. And yeah, thank you, sir, for giving me this opportunity to be able to present this. And this has been on my mind since a long time, and I finally got this opportunity. Thank you so much for having me. And it's been an honor to be a part of Prep Medico faculty and have this opportunity to guide the people who are in need. Yeah, thank you so much. It's been a wonderful session.
Thank you. Thank you, everyone. And thank you, backend team, for your time. Thank you all.
Thank you.
See you.